My name is Nema Shireen. I'm 21 years old. I'm originally from Rwanda, but I have now settled in Nakivale, a refugee settlement, where I live with the father of my children. I have one child who is 3 years old, and I'm currently 7 months pregnant with my second. Before, I had no knowledge about childbirth or how to prepare for delivery. When I gave birth to my first child, I faced many difficulties because I was not well prepared as a mother. I missed antenatal care and drug delivery. I experienced complications that led to me developing fistula. Shared Action Africa has done a great job of reaching out to us in our villages, educating us on family planning and teaching us how to properly feed our children. The healthy care workers from Shared Action Africa have taught us how to maintain hygiene during pregnancy, how to take care of ourselves through proper nutrition, and the best sleeping positions for a healthy pregnancy. We have also received training on which jobs and activities are safe during pregnancy and which ones to avoid. Additionally, we receive free medical treatment on time, and our pregnancies are monitored regularly to ensure we are prepared for any challenges. Through these lessons, we have learned the importance of child spacing and now have a better understanding of the family planning methods that work best for our bodies.
My name is Shiba, Adolescent, Sexual and Reproductive Health Officer. I work with Shared Action Africa. And the challenges that these adolescents face, they always have unwanted pregnancies. There is gender-based violence. We provide family planning services. Of course, we have very many types of family planning. We do counseling. We counsel them about family planning. We teach them about menstrual hygiene and very many others. We always have outreaches for these young people. For outreaches, I mean we go to the communities, we meet these young adolescents, and we teach them. We make groups, we do dialogues with those young people, and we provide these services. For those that can come at the facility, we provide the services from the facility. Of course, we have youth-friendly corners at our facilities.
My name is Jen Wasi and I'm from Rwanda. I truly appreciate Shared Action Africa for transforming my family's life. This organization has played a crucial role in my journey as a mother. They educated both women and men on how to create a better home life. The father of my children and I used to quarrel and fight almost every day, but through the healthy workers and peer educators who visited our home, we have changed for the better. Their guidance has restored happiness, peace and unity in our family, benefiting both us and our children. The Shared Action Africa team listens to us individually, allowing us to share our challenges privately as mothers. They pay attention to our healthy and personal concerns, ensuring that every detail is addressed with care. Personally, I used to give birth at home, and my firstborn, who is now 6 years old, was born in such conditions. However, after attending their training and lessons, I chose to give birth in a hospital where I safely delivered my second child, who is now 3 years old. They have taught me the importance of child spacing for better health. Through their support, we have learned how to protect ourselves from sexually transmitted infections. We have access to contraception and family planning services. Additionally, we receive mental health and psychological support through counseling. We are given privacy and feel free to speak with healthy workers whenever we need to. They are always friendly and supportive to all of us mothers.
Matamba Kopwes, working with Shared Action Africa as an Assistant Adolescent Sexual and Reproductive Health Officer. For us, we are focusing on adolescents, and with them, we are offering family planning services and other youth-friendly services to them, like STI treatment. We give contraceptions, we do counseling, and many others to the adolescents majorly. We have many family planning methods that we are offering to them. We have the modern methods, the artificial ones. That is, we give implanon, which are for 3 years. We give Jadel, which is for 5 years. And we also offer them the IUDs, which are for 10 years. We also give them injectables. We have the Poprovela for 3 months, and also Cyanaplex is also for 3 months. And then we also go ahead and give them treatment and also examine them on STIs, on the sexually transmitted diseases. That is, we've found out that they are mostly affected with some STIs, that is gonorrhea, they have chlamydia, we have syphilis, usually affecting the adolescents in the camp. And there, we give them treatment, we also give testing, we give them, we test them through our laboratories that are always here in our facilities. We give them treatment, we give them counseling, and we also give them other services. Also, like those ones who are working in risky places, we offer them condoms if they want and teach them how to use them. And then to the adolescents who are early teenagers who are pregnant, we offer them services also. Now that we are even being affected by this pandemic that has affected us, we are giving them, we came in and also do antenatal, we give them these services, we do outreaches to the community to make sure they are able to get these services. In this time that we are not having health workers at the facilities who have been engaging themselves in these outreaches, we've stepped in and we are also doing these antenatals from their communities, offering them they are testing maybe on the first antenatals, we are testing for urinalysis, testing for hepatitis, giving them treatment like mebendazole, giving them IPTs, offering also ferrous sulfate and folic acid to those ones in the first trimester and those ones in other trimesters. We are also giving them counseling. Now that they are even at a younger age and they have gotten pregnant, we tell them on such many activities they are to engage themselves in and how to remain healthy, to eat well, to ensure that the diet is good, and many others concerning pregnancy and all the youth-friendly services.
My name is Sherry Bonita. I live in Nakivale, refugee settlement. I'm 22 years old and a mother of 2 children. My first is 7 years old and my second is 5. I'm currently 6 months pregnant with my 3rd child. I'm originally from Congo, but I was forced to leave due to war and resettled in Nakivale. Shared Action Africa has played a significant role in my life as a young mother. They have provided me with counseling and guidance on family planning and educated me on how to protect myself and the father of my children from diseases like HIV/AIDS. I received timely antenatal care and proper treatment during my pregnancy, as I often fall sick. Through their support, my partner and I have learned how to be responsible parents, providing good care for our children. We manage our limited resources wisely to ensure our children have a balanced diet. Thanks to Shared Action Africa's reproductive health services, all our children are healthy and safe.
I send my greetings from Shared Action Africa in Nakivale refugee settlement. My name is Kamsime Adela. I work as a sexual and reproductive health officer. I'm a trained midwife and I'm a midwife by profession. I've been a midwife for quite some time, that is like 7 years, and I've been dealing with women, especially adolescents or young people. The young people, what I mean, we are looking at the people who are 10 years up to 24 years of age. Yeah, we are dealing with them in terms of SRH services, whereby we are giving services at a level of health centers. How we deal with these adolescents, we are having a special clinic where adolescents come to the hospitals, because we don't expect them to make lines with other people like their mothers, their elder sisters, because they find it so uncomfortable to stand on the same line or on the waiting queues with them. So how we deal with their psychosocial support, or how we deal with the stigma in the community about the SRH services, like how I have said, we are having private places. We actually call them youth corners, where we put a certain health worker to be there, guys, purposely for those adolescents that come to these facilities. So this health worker is responsible for these adolescents in engaging them like counseling, in providing all the services that they need according to the SRH. Then we are facing some challenges. It is because that our young people in the Nakivale settlement, they are quite expectant. They expect a lot, actually not only the young people, but also their parents. They do expect much, even more than what we provide. When we talk about the SRH services, we are meaning the services concerning their health. But on top of that, they be expecting incentives. They expect incentives like maybe money. They expect like refreshments when they come to their clinics for the health educations and counseling. It's quite a challenge that the people you're minding about on their reproductive health, they are now only thinking about something small like a soda. My recommendations would be that if other humanitarian organizations are coming to join us in the refugee settlement, we wouldn't want to only stop at giving the SRH services. We would also want to look at the skilling of these adolescents. For example, skilling them with the sewing machines, skilling them with a computer, skilling them with other things, even also engaging them in games. I would talk about like indoor games whereby youth come and start playing like Ludo, they play like cards, that during that time when they are having their games like the Ludo, playing cards, chess, they would also think about other things. They would do peer-to-peer, and they talk about their services that they receive. It would help us to attract more numbers.